and good afternoon. It is February 21, 2023. I'm Dr. Duke Majan with my team here at Duke Spine. This patient comes to us from the state of Florida, Jacksonville, Florida, and he's had chronic back pain. He's had previous surgeries like laminectomy. They have not given him the relief that he wants with his back pain, which is no surprise to me. I did not do his laminectomy. And now he's here, and we're going to be doing a Duke laser disc repair, L4-5, L5-S1. Now he does have additional discs, the L3-4, but most of the pain is in the lower back around this area, L4-5, L5-S1, and that's what our target is today. We're going to try to get rid of as much of that back pain with this procedure as possible. All right, we're using a combination of AP and lateral fluoroscopy, looking from the front and the side. AP is front back, lateral is from the side. We use two views, AP lateral, to navigate. Everything okay?
Yep, I just put an electric key.
All right, so far so good, Sean? Yeah, so we're right there at the back of the disc. And let's get a lateral and then an AP. All right, AP. Let's just see where we are. So the hardest part of the surgery, in my opinion, is the beginning. It's placement of the spinal needles. Perfect. Let's go back to a lateral. The L5-S1, the disc we're currently placing, is always the hardest. Most transforaminal spine surgeons, and there's only a handful in the world, won't do L5-S1
just lay still.
transforaminally. Shot. Where do you feel it?
Where are you feeling that, sir? My friend, where are you feeling that? In the back?
What? All right. And he's pretty collapsed. Let's have an AP. So L5-S1 is a, people ask me, Dr. Duke Majan, does the Duke laser disc repair work for a degenerated disc? This is a degenerated disc. This is as degenerated as it gets. So the answer is yes, it works. And the L4-5 is degenerated as well. So let's take a look on the side view. Shot. All right, Jordan, show us L5-S1. Look how collapsed this disc is. Compare it to the one above, L4-5, almost just as collapsed. And then look at L3-4. Look at how big that L3-4 is. That's a more normal disc, and even that one's collapsing. We were going to treat that one as well, but the patient wanted to hold off. We're just treating the bottom two. All right, at this point, we've got you can't let your fingers get in the way, okay? You cannot do that. You've got to hand it in such a way that the blade does not touch you. So we're making our 7mm skin incision, and we're going to enter the L4-5 disc next. We've already at L5-S1. I always start with the hardest. Watch your fingers. Shot. And the reason I start with the hardest is the hardest means you're going to have to change your entry point and your target a little. Well, your target doesn't really change. It's your entry point, but where your waypoints, let's call them waypoints. So right now you see the tip of the needle at 4-5. It's not where I want it to be. It's not at the target. Show us the target. There. But it's at a waypoint, and the waypoint is the facet. So you may have to change your entry point and your waypoints. If you understand navigation, what a waypoint is. Shot, don't move, you're doing great. And that's why I always started L5-S1, shot the hardest one, because that determines everything for the rest of the surgery. AP. And you're a little bit overexposed, Jordan. All right, that looks good. Looks really good. All right, so we're almost at the mid-pedicular line, which is where the back of the disc is. And you cannot use just an AP view because you'll never know where the disc is. You have to use a lateral view. It's perfect. Is he comfy?
You doing okay, my friend?
Sean?
Your neck's hurting a little?
But nothing down your leg.
You want to turn your head to the side? Did that help you? Rotate to the side.
No pain down your leg,
Any
right?
pain in
Right?
your leg?
All right. All right. Are you comfortable? Good. Now, how long have you had back pain for? How long have you had back pain for?
How many years?
You never had it before 6 years? How many years ago? 17. So for 17 years you've had back pain, and it's been constant for 6 years? Yeah. But it's been on and off before that, right? Now when I asked you where your pain was, you told me it's in this area, which is where the L4-5 and L5-S1 discs are, right? Where you had surgery, you had a laminectomy. How many laminectomies did you have?
You had an endoscopic on that.
Right. You had an endoscopic surgery, which really wasn't so endoscopic, right? So you all can see this is endoscopic right here. And his endoscopic cut was from here to here. But you know what? If the surgeon says it's endoscopic, it's got to be endoscopic, right? But I guess maybe that surgeon thought that was endoscopic. All right, are you comfortable? Any pain? In your neck? No back pain though. All right, that's where I cut your skin, that's all. You comfy? Lay still. Good.
Stay still.
How bad is that on a scale of 1 to 10? How high? A good 9? Is that where you get your back pain? All right, that was a 9 out of 10 at L5-S1. That was your bottom disc. Better now? 9 out of 10 concordant at L5-S1. Better? Is the pain gone? I couldn't hear what he's saying.
Other than a little pinch there.
All right, the pinch is your incision where we cut you. All right, better? All right, good. Did you get that picture there, Henry? The lateral x-ray?
Yes, we did.
All right, Jordan, show us where the tear is that we're fixing today, the annular tear, where the annular tear and herniation are. Good. Yep, that's it. That's what we're going to go fix. All right. You comfy?
Yes, I am.
Excellent. How bad is that on a scale of 1 to 10?
That's about 10, easy.
10, all right. Now, so one disc was a 9 out of 10, the other one was a 10 out of 10, and that was your L4-5. Is that where you get back pain typically? Okay, good news. That pain is going to be gone when you wake up. All right. I want you to count out loud from 1 to 100. Count out loud from 1 to 100 so we can all hear you.
1, 2, 3.
You want to start at 4, 5 then?
Yes, please.
Keep going. So as he's counting, my anesthesiologist is putting him to sleep with propofol. Shot. I'm going to remove this spinal needle. And let's show the audience why patients have so much back pain that comes from a disc. Like, how does the disc actually cause back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain.
Right. You showed the audience the educational video, right?
Correct. Why we get back pain.
Huh?
Why we get back pain.
Yes, yeah. You said commercial, but you meant the education.
Educational,
All right,
I
all right.
apologize, yes, my
No
bad.
problem. All right, so stay where you are. I'm going to show you for the first time, because we haven't done this before, what it means to go transforaminal, okay? We talk about transforaminal endoscopic surgery. That's what we're doing here. So I'm going to show you a few snapshots or even a cine view. So stay on the fluoro, okay, Henry? And I'm going to show you the tip of this dilator. Go ahead and show them the tip of the dilator with the arrow. Just the arrow. See the tip of the dilator, folks? That's the outside of the foramen. We're going to go through the foramen right now as I do a cine view, which is like a movie. Ready? And go. All right. So we're now at the back of the disc, and that's your cine view. Let's go lateral. So you saw the tip of the dilator go from the side to the inside, outside to inside of the foramen. It's not a very big distance. The foramen is pretty small. It's about the width of your pinky. And now we're going to go back to a lateral view so that I could see the dilator go inside the disc. Okay? And this is where we have to use a hammer, or mallet we call it, and basically entering his disc through the herniation. And it's a pretty big tear there because it's going in easy. Beautiful. So now we're inside the L4-5 disc. That was a 10 out of 10 pain when we tested it with the discogram. All right, we've got the dilator in. Henry, can you see this metal straw, so to speak?
Yes, we can.
We call this a tubular retractor. It's designed for endoscopic surgery. This is a uniportal. Everyone else over in Europe and Asia and India are doing biportal. Biportal means 2 holes, 2 ports, totally unnecessary, more destruction and damage to your body. So this is far less destructive. And you can see it's got a window or an aperture there at the end, okay? So we're going to slide this down, and we're going to go into the disc. Once again, I use a mallet, and I use an impactor, and I use my lateral view to advance the endoscopic tube. Any questions from our audience?
No current questions. Just a comment from Canes25 saying those are some huge tears. Good thing he has you to repair them.
Thank you. It's a good thing I've got Luis to pull that dilator out. All right, tube is in place based on the x-ray, perfect position. At this point, we're going to pull the fluoro out, or x-ray machine out, same thing. And we're going to, you can see this is a thin patient. Henry, you see the shaft, how much of the shaft is sticking out?
Yes, we do.
That's a good 9 inches. I'm just kidding. It's more like 4 inches. Some guys would say 9 inches, but to me that's more like 4 inches. Anyway, a little humor. Long story short, we've had patients where this entire tube is inside them to be in the same place of the disc. And what that means is that this is about half of the shaft length sticking out of the patient. We've had patients that are large with spines very anterior where literally this fluid adapter and the entire length of the shaft is inside the patient. So everybody's different. This patient is thin and their spine is relatively posterior. So I just wanted to point that out because we have every size patient and every geometry, and you have to be able to adapt to each patient. It's a little bit different for each patient. All right, we're going to go in now with the endoscope, and we're going to find the herniation and annular tear both. We're going to remove the herniation, and we're going to repair the annular tear. Any questions?
No current questions, just a comment from Canes 25 once more saying, oh yes, I can't leave out your team of all-stars.
Hey, thank you. I'll speak for them since I have the mic. They appreciate it. That's the herniation, or part of it. You're doing great. Lay still. So our patients that have this type of surgery, they don't have general anesthesia. They're having what we call propofol sedation. And propofol sedation is medicine that goes through the vein, and basically it makes the patient's brain go to sleep. We use it a lot in medicine. It's literally the favorite drug to use right now in 2023 for making patients sleep. But the thing about propofol is that it has no pain-killing ability, no analgesic effect. The only thing, and it has no amnestic effect. Doesn't make you forget. The only thing it does is make you unaware. So it makes you unconscious, but you can still feel pain. So we actually have to give our patients a little bit of fentanyl, painkiller, along with the propofol when they're getting a little too much pain. And the fentanyl, as you know, can be dangerous. So when you have an unsecured airway, you want to monitor the vitals carefully and make sure, hey, you moving just a little bit? Make sure that you keep the patient safe. Any questions, Henry?
No current question.
All right. See, there's a lot of herniation here. See that? And it's scarred up. That's what the white stuff is holding it in. There's a piece of herniation right there. Oscar, you're doing good? I haven't yelled at you yet. That's a good sign. What? Everybody get something to eat for lunch? All right. Very good. So then why don't we show the audience our other educational video on the lower back. What does this Duke laser disc repair surgery actually do?
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Henry and I were just having a discussion about commercials and what what they're derived from. They're derived from the word commerce. Commerce means business or sales, basically. And the original commercials on radio, because that's all there used to be a long time ago, were radio commercials. They were blurbs focused on generating more commerce for businesses that were advertising on the radio station. But we like to think about what we're doing as more educational rather than commerce. Really, it's about teaching what's happening, what's available, the truth, rather than packaging up some commercial. All right, there's the tear. You can see it in the annulus. I'm debriding it with the laser. Everything okay, doctor?
Yeah, we're just retaking the
No issues, though?
No.
All right. Yeah, the last patient that had the thoracic plasma rhizotomy, he was crying in the recovery room, and it made me about to cry because he was talking about how miserable his life was before he came to us, and now his pain is all gone. And he said that he was even considering suicide at one point a year ago because he was in pain all the time, and the doctors kept doing treatments that didn't work. And he said he would go from doctor to doctor, and everyone did procedures on him, and nothing helped. It all made him worse. He said this is the first time he's actually been pain-free. And it was very emotional for him and his wife. They have children. And I understand what he's saying because, yeah, wonderful people. Because pain is dehumanizing. It literally makes you not feel like a human being. Humans aren't meant to feel pain like that. And I don't know, some of you might remember 6 months ago I had a broadcast where I talked about an experience I had over in, when Arius was racing in F4 over in Holland, in Amsterdam area, where I had a vision that of what the brain's purpose was, and it all made sense. It's basically all these sensory inputs going into your brain, and the purpose of the higher functioning areas of the brain is to regulate those inputs, because they can be overloading if you're just in pain all the time. You're feeling pain nonstop. It's a massive amount of sensory input to the conscious levels of the mind. And some of these people who have unregulated pain, nonstop, every day, constantly, their lives are miserable and they don't want to live. And they could take their lives. And that's one of the reasons I do what I do. It's to prevent suicide. People don't like to talk about it, but it's true. Lots of people with chronic pain commit suicide. And what I want is I want that to end. I want to get rid of pain. What do you need? Everything okay? Get over there. He needs you. All right, I need just another minute or two at this disc and we'll move on. Any questions?
No current questions. We have another comment from Canes25 that says, "Yes, sir. I love watching you. I learned so much. When you're young, learning is a chore, but as you get older, it becomes a joy."
Yeah, true. Great point. Thanks for sharing, Haynes25. All right, you can see the tear here. Just so much grunginess, is, for lack of a better word. All this stuff here is scar tissue and calcification of abnormal disc. This is where all the pain generators are in the disc. It's in the tear. We clean the tear up and it takes care of the pain generator. Well, we appreciate the comments from our viewers. We appreciate the questions from our viewers. Again, this is the L4-5, right, Luis? We're going to do L5-S1 next. Just about finished. For those of you who follow Duke Spine regularly, we are announcing today that we've offered a job to Dr. Patel's fellow, Dr. Francis Cini from, she's from Puerto Rico, right? Yes. And she's phenomenal. Everyone loves her. She's a great doctor. And we've offered her the job and she's accepted it. So she's going to become a permanent part of Duke Spine Institute. I think I made some people happy with that announcement. We don't hire fellows normally, we just train them. But when we hire a fellow, they have to be special, very special. For us just to bring a fellow on, they have to be special, but to hire them as a permanent part of our team, they have to be extra special. Just about done here. So much herniation here. Another minute maybe. Our next surgery after this is going to be a patient who's getting the Duke plasma rhizotomy for facet joint pain. Some of you have heard of radiofrequency ablation. This is the next level up, the improvement on technique. All right. Well, look at that. There's the nerve root right there. Pretty cool, huh? And we're just below it. People say, how do you make sure you don't damage the nerve? Well, we protect it with the cannula. We cover it, make sure it's outside. And it's nowhere near the laser. You can see we're awfully close. And especially a patient who's had prior surgery like this, you can see how scarred up the nerve is. So, well, we're done. Lights on, please. Thank you. So we have one more disc to do. I'm going to put a little antiseptic. We call it betadine. And we're going to irrigate it. We've never had an infection with the Duke laser disc repair because it's so minimally invasive and there's no bleeding really, and there's no implants going in. So no bleeding, no implants, small incision, quick surgery, all those things. Fast operating time, small incision, no implants, no biologics, and obviously very good sterile technique. All those things are important in reducing the risk of infection. Most spine surgeries are long and big incisions, lots of bleeding, take too long, and you're putting foreign bodies in that can actually get infected. Any questions? Bring our fluoro. Watch behind you, Oscar. Move.
Yes, we have a question from Matt Sorger on Facebook.
Hi, Matt.
And they asked, question, after the discs are clean, is it possible that the nerves can still be damaged from being compressed for so long, causing issues afterwards?
Yeah, great question. So one of our viewers, Matt, from Facebook?
Correct.
Or YouTube?
Correct, Facebook.
From Facebook is saying, Dr. Duke, so is it possible that even after you unpinch those nerves by removing the herniation, that they could still be damaged because of being compressed for so long? The answer is absolutely correct. And we never know before surgery who's going to have nerve damage that doesn't go away. But I can tell you this for sure. If you don't have the surgery, you're guaranteed to keep having nerve damage. If you get the surgery, you give yourself the best chance possible of getting rid of nerve damage. That's what I could tell you. All right, we've done L4-5. Now we're going to go down and do L5-S1. Same incision. Yeah. You guys see this?
Yes, we do.
We're not giants. That's a 7 millimeter incision. All right. A 7 millimeter. You guys see that?
Yes, we do.
Maybe it's 8 millimeters today. Got a little heavy-handed with the scalpel. Added an extra millimeter. Shame on me. Luis has become Dr. Berndez's #1 fan, or Dr. Berndez has become Luis's #1 fan. I'm not sure.
It's symbiotic.
They love giving local anesthetic. Shot? Alrighty then. Uh-huh. All right. So I'm at the back of this disc. Mallet. Shot. Shot.
Okay, buddy. You're doing great.
He's not liking that at all. That's the painful disc. His nerve, I could feel, is stuck down to the back of that disc. So he's had prior surgeries before, and I told him it's going to take a while for those nerves to heal up. Shot? Yep. So people with prior back surgery, they're the ones that honestly, if they have scar tissue, which they all do, scarring their nerve down, it makes it a lot harder for me to do the surgery. It makes it riskier for them to have a problem with the nerve. Generally, when we do have nerve root issues, it's always temporary, and these patients may have what's called nerve root regeneration pain. So when you get the pressure off a nerve root, it's starting to work again. It can feel again, basically, because the herniation will choke it so that you don't get signals going up the nerve to your brain. Well, when you unpinch it, the nerve root, by removing the herniation, a lot of times the nerve needs time to heal. And as it's healing, it hurts. Some people describe a sunburn feeling. Grabber. Some people describe lightning pains. So the good thing is that I've never had a patient, maybe one in all 16 years I've been doing this, where they had a drop foot when they came to me and it didn't get better. All the other ones, their weakness improved. But maybe one of them, the weakness didn't improve. That was a year after surgery, and they hadn't really shown much improvement at all. So I would say the vast majority of patients that have nerve damage coming into the surgery, their nerve damage is going to get better over time. Here's a herniation. And it's just a matter of being patient. I tell all my patients, the ones that have the nerve root regeneration pain are the ones usually that had prior back surgery. So my advice to you, don't get a laminectomy done. Laminectomy is, I don't know how to tell you what a laminectomy is. It's a horrible surgery, and I don't do them anymore unless I'm fusing. And I do them as part of a fusion only. But by itself, which, by the way, it's the most common surgery done, the only reason you do a laminectomy now is if you want to prepare the patient for a fusion. So you do the laminectomy, you get the patient hurting real bad afterwards, so they're begging you for a fusion. A lot of doctors have this conversation. Okay, your back's bad, I say we do a fusion. Oh God, I don't want a fusion. Okay, let's do a laminectomy, because you'll be begging me for a fusion when you come back 6 months later. So it's just ridiculous to me. Don't do the laminectomy. It's going to end up destabilizing the patient. They're going to have to come back and get a fusion done or another procedure like Duke laser disc repair. So don't even do the laminectomy in the first place. There's going to be a day in the future of spine care where laminectomies won't be done anymore. All right? Just like there's, you know, we don't use payphones anymore. Okay? For those of you who know what a payphone is, everyone uses their cell phone. They don't stop, pull over at a convenience store to make a phone call. But that's, when I grew up, that's what we did. By the way, this is where all the back pain's coming from, this little pink area right there. I'm almost done. 3 minutes. Yeah, you can give more medicine. I need 3 minutes. We'll be done. We're going to be done in 3 minutes. So, Henry, any questions?
No current questions, but we do have a comment from SR on YouTube. And they commented, I've had 3 neck surgeries and 13 back surgeries.
Jesus.
Most of my C-spine is
So sorry.
fused. Also T10 through S2 and pelvis.
So sorry to hear that. Yeah, I'm so sorry to hear that. You know, someday that's not going to happen anymore. You know, we're trying to get the insurance companies on board. They don't realize it, but this surgery is going to save them billions and billions of dollars. Literally billions of dollars. I just need to get to them. They'll understand it eventually. They keep paying for all these surgeries that don't work. And meanwhile, the ones that do work, they've got to stop rewarding spine surgeons for doing medieval barbaric surgery. That's what they're doing right now. You get rewarded as a spine surgeon for doing fusion. You get rewarded as a spine surgeon for doing multiple surgeries. The more surgery you do, the more money you make. I mean, it's just wrong. It needs to change. All the pain management, IPM, needs to stop. Yes, I'm hiring a pain management doc, but eventually she's going to be doing my procedures here. And these procedures work. You have to target the pain source, and there should be one treatment, and that's it. You're done. Okay? Now, some people have piriformis syndrome. Some people have sacroiliac joint pain. Some people have facet pain. It's not the disc. It's a separate problem. That needs to be addressed separately. But doing treatments for back pain that don't work, we have to stop it. All right, we're just about done. Look how scarred up this area back here is at 5-1. Huge arthritis. This has been going on for many years. Okay, this is not something that just happened yesterday. Compare this. Look at that. He's moving. Oh, I'm done. I'm done. You're fine. Lay still. All right, all right.
You're doing great.
Yeah.
Almost done.
Lay still. Done in 30 seconds. Done. We're done.
Lights on, please.
Just lay still. No, just the steroid. Give me the dilator to suck out the juice. We're done. We're done. What is this? Oh, no, sorry. Duh. Scope off. I'm not even thinking. At least you're supposed to be my thinking.
9 inches is too big, man.
Good job. Whoa. Good job. Hey, Oscar. My gosh. You're filling some big shoes there, Oscar. Putting pressure here. Let's show the audience the incision real quick. Look at that, Henry. Look at that. 8 millimeters. 2 discs. Anywhere else he would have been fused and he would be in the hospital for a week. Here, he's going home in an hour. No fusion. Ready to take off the field. All right, type your questions up. I'll come answer them for you. Our next patient's going to be a L5-S1 Duke plasma rhizotomy for facet joint pain. Thanks, everybody. Great work. And good morning, I'm Dr. Duke Majan. I'm here with one of my lovely patients from Canada who has visited us because her back has been hurting for 7 years. She's had a herniated disc that she's been kind of monitoring at L5-S1. And finally, it really started bothering her a lot over the last 7 months to a year, causing pain down into her right leg. So she decided to do something about it, and she went to see her doctor in Canada, who then said, yeah, I'll have you see the specialist in 3.5 years. Well, that wasn't going to work for you, right?
No.
Yeah, because you don't want to live in pain for 3.5 more years. And even then, you don't know what you're going to be offered. But she found the Duke Spine Institute and learned about the Duke laser disc repair endoscopic surgery. And you had it done yesterday.
Yes, yeah.
How are you doing?
I'm feeling great today. I have no pain in my back. I have some tight muscles from me having to walk very oddly for quite a while due to the sciatic pain. I must say, this is the happiest I've been in a very long time to be able to stand up straight and go for a walk. Because I'm an active person as is. I ride horses for a living, so having to be locked up in my room for the past while has not been good. So this has felt amazing, amazing.
So you're happy with the results?
Very. I feel very hopeful also to be able to do what I want to for the rest of my life.
Yeah, after we let the disc heal, right?
Yes, full year of nothing, and then we can.
Yeah, I wouldn't say nothing, but you know, horseback riding, it's one of those things where I love horses and I love riding horses. I'm not very good at it, but I'm one of those people you see bouncing up and down, up in the saddle. So I know that it can be rough on your back, and I just want to make sure you give your back a full year to heal. So you can see in your surgery right here, we actually tested your L5-S1 disc with a discogram, which is a test done to verify that that disc is indeed causing your back pain. And when we tested it, you said, and we asked you how bad it was, you said 10 out of 10 pain. And I said, is that your typical pain you get every day? And you said, yes, it is. So we verified the source of your pain was the L5-S1, and you can see the laser was used to clean the tear endoscopically. Your incision was only a 1/4 inch, and there's no need for fusion or metal or artificial discs. This surgery replaces fusion and artificial discs. What are you going to do now that you're feeling better?
Well, again, don't worry, I will take it easy, I promise. But no, I'm going to be, after this, this year, I hope to be the strongest I've ever been, and I have very high hopes and whatnot. My dream is to make actually the Canadian Olympic team for my sport, and that's end goal, and I feel like it's a possibility now.
Absolutely.
Do it.
You can.
Yeah.
We're rooting for you. And I know you have an incredibly supportive husband who's been by your side the whole time. He's a delightful young man, and I've had time to talk to him as well. So you're lucky you have support from your family to help you get through this.
Yeah.
Anything you want to say to your fans out there?
Oh, geez, I don't even know where to start other than just this place really can offer you really what either you deserve or what you need going forward to be able to live a happy and good life. And it's amazing to me that literally it was yesterday I woke up from it and I went for a short walk like immediately, and I felt amazing. So it's very hopeful, and if you are suffering from any of it, don't wait, especially for the Canadian system. Come and do this. It's worth it. It's really worth it.
Awesome. And I'm going to be, and my whole team is going to be watching the equestrian sports in the Olympics, looking to see for you to be there.
Yes.
All right.
Awesome.
And
Amazing.
of course, supporting you.
Thank you. Yeah.
All right. Congratulations.
Thank you so much. Thank you.
All right. Take care. And I'm Dr. R. Duke Majan here at the Duke Spine Institute. I'm smiling because I'm sitting with my first surgical patient of 2023. I don't know if you realize that, but you were the first one of this year, of the new year. Now, you had the Duke laser disc repair done on your lower back because you had 3 bad discs, and we did that yesterday.
Yesterday, yes.
And here you are, one day later. How do you feel?
And I feel good. I feel good, and the pain that I've been suffering for months is gone. I mean, I was a little bit sore, but that's from the surgery itself.
Yeah.
But otherwise, I feel good. Feel good.
Now, you've had back pain too, on and off for 30 years. We were talking about that. Tell us about those episodes of back pain. What do they do to you?
The first one that I recall was pulling out a sofa bed thing. And I got so far with it, you know, we had company and I was opening up the bed and all of a sudden I just could not move. I couldn't move. My husband had to practically carry me. So I was out of work for a week or so and then at the chiropractor and then gradually it got better and I thought, well, that's fine. And I moved on and then, you know, had a couple other times like that. One time I was drying my hair, getting ready for work with the blow dryer going like this with my hair and all of a sudden it's like I couldn't move. I couldn't move my arm down. I couldn't, I mean, it was that quick.
Yeah.
And just, I was out again for another week, laying in the bed and doing all that stuff. And then I thought I was fine, but I always, not always, but for many years now, probably at least those 30, I had lower back pain, where in the morning I couldn't bend over to brush my teeth. You know, that would really hurt.
Yes.
So I had that.
Do you have that pain now?
No, I don't think so.
It's gone.
The pain this morning, I was the first time in a long time I've gotten up first thing in the morning and was able to walk and not have that awful pain, because first thing in the mornings was the toughest.
I'm so happy for you. So how is this surgery going to help you in your life?
Well, hopefully I can, once I can at least walk again. I was not able to barely walk with a walker. I was very active in my church and my community.
So you want to get active again?
And being in such pain now since July, and this is the new year, I'm anxious to get back to, you know, my life.
Yes, of course. Well, you had 3 herniated discs in your lower back, and you can see in the footage where we went into each of those 3 discs, and I used a laser to clean the tear, where you had a tear in the back of each of those discs called an annular tear, and the jelly from the center was stuck in the tear, holding it open, allowing more herniations to come out. So I got rid of the jelly that was in there using the laser, cleaned out the tear, and now your body will be able to heal that for the first time in 30 years. So I don't expect you to ever have that pain ever again.
Thank you.
You're welcome.
I am so thankful.
Well, you had faith and you found us.
Yes, I did.
You did what's right for your body, and I'm excited for you. So
I believe I did. I just kind of was led to you, and it just all went bing, bang, boom, and I didn't ask a whole lot of other people what they thought. I just did what I thought was I needed to do.
Good.
For me.
Is there anything you want to say to your fans out there?
I would recommend that if you do something to your back, that you take care of it early on. You take care of it right away. The longer you wait, the harder it is and the longer it takes.
It takes a toll on your life.
Oh, definitely. It has taken a toll on mine since this summer, for sure, where I have not been able to, sometimes not function at all, barely be able to sit in a chair and be comfortable without squirming because I couldn't find that exact place where I didn't have pain. You know?
I don't see you squirming anymore.
No, I'm not squirming. I know. That's great. Sit here without pain.
Congratulations.
Thanks to you.
All right, have a blessed day.
Thank you. You do as well.
I'm Dr. Duke Majan, and welcome back to our broadcast. You've watched a few of our patients who have had the Duke laser disc repair done on their backs and successful outcomes with complete elimination of back pain. This patient had, when we tested his 2 discs, he had 9 out of 10 pain at L5-S1 and 10 out of 10 pain at L4-5. So we basically confirmed during surgery that the 2 discs we're fixing are the cause of his back pain. And of course his leg symptoms were on the right, so we went on the right side. That way we treat the back pain from the disc and the leg pain from the nerve root. Now, everything went well. I think the patient's going to do fantastic. He lives in Jacksonville, so he's going to head back to Jacksonville, Florida in about an hour. Any questions?
No current questions, but we do have another comment from SR on YouTube when he was talking about his neck surgeries and 13 back surgeries. He's added, pain is still there, but improved and managed. Wish I had been able to wait until you were practicing.
SR, thank you for joining our broadcast and sharing your, I hate to say, but the truth is, horrific story. 13 back surgeries. This is becoming the standard of care. 13 to 20 back procedures, $250 to $1 million out of pocket. It is obscene. We could have fixed you with one procedure, one surgery day, fix the disc, fix the facets, whatever needs to be done. And I just say that because I want people to understand that 13 back surgeries is no longer going to be the standard. It's no longer going to be what everybody gets. Someday, when everyone gets their head screwed on right and the insurance companies come around to paying for the surgery more consistently, we're going to get people having one back surgery and no more. And I'm looking forward to that day. And speaking of insurances, my team has presented me with something very special today. We get a lot of people saying, why doesn't insurance cover your surgery, your Duke laser disc repair? And I tell you, they do, they just don't cover it consistently because we don't have a contract. And when you don't have a contract, insurance companies, well, they just kind of flip a coin. And the coin they flip has 19 sides head, one side tail. So about 1 in 20 claims they'll actually pay. That's a really weird coin, but they've got it. So I wanted to share with you a little bit of happy news. This is from, look at the top, Blue Cross Blue Shield. This is a payment we just received for one of our laser surgeries. Okay, so does Blue Cross Blue Shield pay for the laser surgery? Yes, it does. Does it pay for the laser surgery consistently? No, it doesn't. And that's the problem. We need to get contracts so that they pay consistently and we start taking patients away from a system that's completely broken, like the gentleman or the person, I don't know if it's a man or woman, but they had 12 back surgeries or 13 back surgeries and 6 neck surgeries. That's got to stop because those bills for those surgeries are over $1 million and you could pay under $100,000, less than 10%, and get everything fixed. So I'm hoping for that day to come. We broadcast these surgeries so people can learn the truth. I always try to tell everybody everything I know to be truthful. That way people can make good decisions, informed decisions for their health care. Thanks for joining us. I don't think we have any questions. Our next patient's going to have the Duke plasma rhizotomy, and we're treating the facet joints. I'll show you what we're going to do. For those who will be joining us, the facet joints, unlike the disc is a giant joint between the bones in the front. The facet joints are small joints in the back. And you can see right here this little red dot, right? Oh,
Kind of.
not really.
Not
Let's
really.
see. There we go.
Yeah,
Maybe
a little
there.
bit. Yeah.
See that tiny red dot there?
Yes.
That is a rhizotomy burn from an RFA, radiofrequency ablation. That's why they don't work and they don't last. They're tiny. But then when you do the Duke plasma rhizotomy, look at the difference. You're now getting a giant burn right there, which is why we're able to get rid of the pain so much better. For those of you who don't know what the medial branch of the dorsal ramus looks like, that's what it looks like right there, and that's what I'm trying to target with the procedure. Okay, so that'll be next. Feel free to join it, and